Welcome to our show. You're listening to Palm Beach Music Therapy Connections, a place to learn about and celebrate creative arts therapy. Each week we'll explore new ways that music, art, and dance can reach, connect with, and help individuals of all stages of health and wellness. Hi, I'm Bree, Beynon, a board-certified music therapist and the managing partner for the Palm Beach Music Therapy Institute. Tune in as I interview professionals from healthcare and educational backgrounds on the impact of the creative arts. If you prefer to watch our live video stream, simply visit www.pbmti.com. Hello, good evening. Thank you so much for listening to and watching Palm Beach Music Therapy Connections. I'm your host, Bree Beynon, board-certified music therapist and certified neurologic music therapist, working here locally in Southeast Florida with the Palm Beach Music Therapy Institute. We've been talking a lot about different creative arts therapies in the community and throughout the country, really. Had the honor of not only talking to those within my field of music therapy, but also in art therapy and dance and movement therapy. And I know I've gotten to learn a lot by reaching out to people in the community and seeing what other creative approaches there are to healthcare and education. And in that, when we were talking to art therapists and a movement therapist, we talked a lot about creative ways to approach recovery, addiction recovery, substance abuse recovery, but we haven't shone a light really on music therapy in that setting. So that's what we're going to be focused on today, the role that music therapy can play in the recovery process when you're mental health in general, but specifically in addiction recovery. We live in an area where there are a lot of opportunities for this. Our area is very rich with rehab centers, substance abuse recovery centers, and it's kind of an area I didn't realize our practice would be working in so much when I got into this field, when I moved to this area. I thought very medically based about going into a hospital program, hospice being my background, or working with children in school, but I didn't realize at the time what a need there was for a creative approach like music therapy in this setting. I've learned so much over the last few years, just not only how important it is and how effective it is, how needed it is, but also how open those that run these programs are to creative arts therapies, which has been a really wonderful partnership in our community. Not only is music therapy an effective modality for treatment in this setting, which we're going to talk about for really the rest of the hour with my guest today, Allie Saylor, who is one of our music therapists at Palm Beach Music Therapy Institute, working solely in addiction recovery centers as her full-time position. So she has a lot of insight on this. She's been with us for almost 2 years now, working with this population. So we're going to be picking her brain about all the different facets that go into working with this population, the benefits, how music can help, why music of all things is so effective. But even more specifically, something that I've noticed working with this population is that there are considerations within it. It's not just like we mentioned when working in the VA setting or in a hospital setting. It's not one size fits all. It's not one music therapy session fits all. These are individuals in recovery centers. So while we're doing a bulk of our work is doing group, we do have to focus on the individual needs of the clients as well, which is why something that I really think is really important is making the distinction between ages, the age that someone is when they start their recovery process, when they come into a rehab setting, and also gender. So we do try to promote that in the settings that we work in, that our groups are kept to a small size, which you've heard me say before. That's true of any client we work with, any client base. We try to keep our groups small so that they can be as therapeutically effective as possible, and that we're able to really give the individuals that kind of one-on-one attention, even in a group setting, especially in a setting like this where the topics that come up and the things that are being processed are so sensitive, they are so private, that we really want to make sure that they get the therapeutic attention that they need that's really going to help the individual work through that. So we try to make sure the groups are small and also specialized to specific ages. So we've worked with, and again, Allie will speak more to this later, but we've worked specifically with teen programs, which is going to be very different than working in an adult program, which is going to be very different than working in an older adult program, which has their own unique set of needs. And even within that, oftentimes we will separate the groups between male and female because of the unique needs that come with those populations as well. So this is some information from the website, that's small, samhsa.gov, Substance Abuse Mental Health Service Association, I believe that stands for. And this is what they have on their website, government website, speaking to just that, those specialized situations between the ages of individuals that you're working with and the gender that you're working with. And they go on to say adolescents and young adults, they're facing a unique set of challenges within their mental health issues just by the age that they're in. They're transitioning. They're in a huge transition period. They are, in 2014, about 1 in 10 youth ages 12 to 17 had a major depressive episode in the past year. Among adolescents with MDE, major depressive episode, 41.2% received treatment for counseling or depression in that year. Another statistic says combined 2010 to 2012 data from the SAMHSA's National Survey on Drug Use and Health indicate that 1 in 5 young adults ages 18 to 25 reported a mental illness in the past year, and 3.9% were diagnosed with a serious mental illness. In 2014, 1.4% of adolescents had a co-occurring MDE, major depressive episode, and a substance abuse disorder. So that's a completely different set of considerations to be thinking about when there are those co-occurring disorders going on, mental health needs. Another reason that I personally am so glad to see that music therapy and the other creative arts therapies are being embraced in this way is because substance abuse, much like other mental health issues, are not readily talked about. They are treated completely different. A mental health concern is treated completely different than a physical concern. We don't want to talk about it. It's a very private issue. It's a stigmatized issue. If you are caring for a loved one or have a loved one in your life that's going through this, you're not as apt to talk about it as if they were sick with the flu or have been diagnosed with cancer. That would be an open thing in most cases, not to generalize, but to reach out to a support group to connect on the unique sets of needs that a caregiver would go through with that. And oftentimes people don't reach out if they are loving and caring for someone who is living with mental illness or struggling with substance abuse. So that brings a whole other set of needs too. That person may not feel like they are as apt to seek that help as if we felt a pain. So you need to be aware of those things as well, and especially in those adolescent and teenage years when they're already dealing with so many other things. Just think back to your normal high school experience and all the different emotions that you feel during that time, and then compound with that with a mental illness diagnosis or struggling with substance abuse. It's going to be a unique situation that adults may be going through something completely different. Jumping to, we also do some programs for older adults, meaning senior age, 65 and older, and that is a completely separate situation because you might be dealing with someone who is coping with loss, loss of a spouse, loss of a parent, loss of a child, loss of independence, coping with their own physical changes on top of mental health issues. A lot of times people who maybe didn't suffer from mental health issues or were working through substance abuse issues before find themselves in a new situation when suddenly they're being prescribed a lot of pain medication. And so that's going to bring about a whole nother separate set of issues which require that sensitivity towards uniquely what they're going through. And again, why we always try to promote keeping those groups small, personalized, because it's more than just using music as a way to forget your troubles and to be creative. It's the therapeutic process. Music is our vehicle for getting to these places, to reaching these individuals, but we need to be able to process through some of the really heavy things that come up out of this. And I know Allie will speak a lot more to it later. I've had the privilege of going in to sit with her on several of her sessions in many different populations, many different settings, and have been so touched every single time. One, that I was even led into this space with these individuals who I was just meeting for the first time, who let me come into their group and be a part of that process, that would trust me, sight unseen, to be a part of that. A lot of that is because of the rapport that the music therapist has already built with these clients in a very transient setting where people are coming in and out and you're constantly meeting new people. When trust is an issue commonly already for those who are living with this diagnosis, it's a really special thing for me to come in and observe that, to see the trust that they would have with the music therapist, often fostered by that relationship within the musical space, which is so amazing. She's going to speak more to what are some examples of interventions that she's used in settings, and you know, some of the things that people have shared that maybe wouldn't be comfortable coming out during a talk therapy session, that they maybe felt comfortable writing about or singing about or processing non-verbally. So it offers a lot of options, creative options for working through this very difficult transition period in their life. One other thing I wanted to touch upon is the considerations between men and women, and treating each of those groups specially according to those needs. There's jobs, responsibilities that each have back home that are really important to consider. I remember covering specifically a women's group, and it was very focused on, it was actually the day after Mother's Day. It was very focused on those feelings of being away from home on Mother's Day. And I think it would have been a different situation maybe if it had been a mixed room and women maybe felt more comfortable being amongst other mothers who were going through the same things that they were. So I was very touched by that. And again, that they would trust me enough to share that with me and that we could work through that together. It's an incredible honor, as working in all of these settings are. So I'm so excited to have with us our very own music therapist, Allie Saylor, MTBC here. She works in several addiction recovery settings here in Palm Beach County and in Broward County. And she's going to be talking us through the goals that she works on, how she uses music in this setting, the interventions that she's using, some really special client stories, and also some challenges that come along with this setting as well, and the emphasis on that team approach of working with the other disciplines to really make sure we're addressing the appropriate needs of the group and the individual. Stick around for the end because she's going to be sharing some music with us as well. We're going to cut to a quick commercial break, but after that I'll introduce you to my guest, Allie Saylor. Stick around.
Mom's fall was a wake-up call. We knew she needed help, but we also knew she'd never leave her home.
With jobs and kids, we can't always be there. We weren't sure who to trust to help around the house and make sure she takes her medications.
We did our research and found our answer. Bright Star Care. Their home care teams are led by registered nurses, with help available 24/7.
Thanks to Bright Star Care, Mom can stay where she wants to be, at home.
For a standard of care that raises the bar, call 844 for Bright Star.
The Palm Beach Music Therapy Institute is a professional music therapy practice serving medical, community, and educational settings throughout Southeast Florida. With our experienced team of 11 board-certified music therapists, we use music and research-based therapeutic interventions to help individuals of all ages and abilities reach their goals and increase their quality of life. For more information on our services and programs, please visit our website at pbmti.com. Engage with us on Facebook, Twitter, or Instagram, or call us at 561-747-9944. You are listening to Palm Beach Music Therapy Connections. If you'd like to join the conversation, the toll-free number is 888-565-1470. Now back to the show. Thank you so much for joining us tonight. You're listening to and watching Palm Beach Music Therapy Connections. My name is Bree Beynon, and I am so excited to introduce you to my guest tonight, one of our very own board-certified music therapists, Allie Saylor. Allie, thank you so much for being here.
Thank you for having me.
It's my pleasure, and this is a topic that's near and dear to my heart, both personally and professionally, so I'm really excited to talk about it again on the show, but specifically this time, the role that music therapy can play in addiction recovery. Before we get into that, if you wouldn't mind just sharing a little bit about your background and how you got interested in music therapy.
Sure. Well, I've been playing the piano since I was 7 years old, so I think for most of my life, I've been involved in music, and I heard about music therapy. I actually heard about it in the context of hospice and end-of-life care. And I thought it was just really cool that somebody could use music to be present at the end of somebody's life when they were transitioning. And I think that's probably what first got me thinking about music therapy. And then I discovered that it was actually something you could major in college, so that really excited me. And that's kind of the direction I decided to take, and here I am.
Very good. And your internship after school wasn't specifically in addiction recovery, but in behavioral health. Right?
Correct.
Okay.
Yeah, I worked at a psych hospital for 6 months as an intern, working with kids and adolescents. So that was the majority of my experience with music therapy.
Okay. And did you feel in that setting as an intern? I mean, we're obviously taking in so much information during those brief 6 months, but how was music particularly effective in that setting?
Well, I was working with kids and teenagers, and most of them really, really loved music. So it was very easy to come up with interventions and songs and, drumming activities that they would really connect with. So I think that was probably something that made that experience really effective.
Sure. Just our natural attraction to music at any age, but especially in our youth, for sure. So how did you kind of come to find yourself working in this setting?
Well, about 2 years ago, I graduated from college, and I moved to South Florida, and I was trying to find some sort of job in music therapy. I wasn't really sure what I was going to do. I kind of thought I might continue with the psych hospital setting, but I just wasn't sure what the needs were down here and what was available. So part of it was me just looking for some sort of job. But then I discovered that South Florida is really a hotbed of recovery and rehabs. And that's kind of related to mental health in a way, because I think addiction happens because of lots of different reasons. So I discovered that rehabs were a big setting for music therapy, and just kind of fell into it and been doing it for the last 2 years.
Yeah, and there's a real need for it as well, like we were
Yeah.
saying earlier. So working in a recovery setting now, and that was something new for you when you started as a professional
Yeah.
music therapist. What has that, in the last couple of years experience been like for you as a music therapist?
Oh boy.
Big
What
question.
has that experience been like? There's been a lot of growing that I've had to do, lots of growing. Like you said, it was something that I had zero experience in before, really didn't know anything about recovery, about the 12 steps, about addiction, other than like kind of hearing of or knowing a few distant people that had experienced that struggle. So I've definitely had to do a lot of learning and growing as a person and as a music therapist. And I guess something I've learned is that you got to expect the unexpected, that anything can happen, especially in the addiction setting. People are cycling through. You meet lots of different people. Some people are there for 30 days, 60 days, 90 days. It's just constant change, not just in the group setting itself, but in the whole field, I guess, is always changing.
And that's so true for a lot, so many settings too, especially when you talk about your first exposure being in hospice care, and that being my professional background, we never knew what situation we were walking into. And I think that's what makes our field so perfect for working in these settings, because we're doing live music for the most part, sometimes using recorded music. We'll talk about that a little bit too. But we're able to use that music to adapt to whatever the situation may be. So to follow up with that, I know that in your work is probably similar to how it is in working in hospice care. You may have an idea in your head of how something's going to go, walk in that day, and it's a completely different situation, right? So, you know, how are you able to kind of respond to that when maybe your session plan for the day is not as appropriate?
Yeah, I guess I've learned to just be flexible and go with the flow. There have definitely been plenty of times where I had something planned. I thought, oh, we're going to do a session on, you know, like anxiety reduction or, you know, maybe relationships or change or whatever it may be. And then I walk in and the clients are just in a completely different place. And I've just had to kind of go with the flow and be open to hearing and responding to their needs, essentially.
Yeah, absolutely. And how important that is for building that rapport, which, especially in that setting, seems to be very important, to have their trust, and that you would listen to them and respond to them. That must mean a lot. So we talked just broadly about session plans, but what are some goals that you would be addressing in a typical session?
The big ones would be like self-awareness. I would say definitely self-expression, fostering authenticity. A lot of it also has to do with relationships, being able to, I guess, connect with people and form and maintain healthy relationships, you know, figuring out what that looks like. And that's something that we can definitely do in a group setting that's perfect for groups. Also, you know, coping skills, anxiety reduction, mood elevation, those are all pretty common goals for the setting.
That's a lot. That's a lot of good things that are important to address, and that music can help with. How would you structure music therapy interventions to address some of those goals?
I would say probably the most common interventions I do would be maybe drum circles or therapeutic drumming. That's particularly relevant to anxiety reduction, positive risk taking, different goals like that. Definitely do a lot of songwriting, a lot of music listening, and kind of, you know, lyric analysis, responding to what the music is telling you, or what the music means to you. Song choice, music and relaxation, those are just a couple of the big ones that I use on a regular basis.
Do you feel like when you're walking to a room, maybe for the first time, or meeting new individuals, are they open to sitting down with an instrument or singing or processing through music? What kind of response do you get?
Honestly, I get a lot of mixed responses. It just depends on the group and kind of sometimes like what their mood is that day. I think most people are very open to music therapy. They think it's something that's really cool, something that is kind of a break from their normal routine. Like they have all these other therapeutic talking groups maybe, and then they come into music and it's just something different. So a lot of times they are very excited about it and motivated at first. But, you know, sometimes people will walk in and they'll see all these drums and it might freak them out a little bit, or they might say, oh, that's childish. Why are we doing this? So sometimes there's a little bit of resistance, I think, at first. But, you know, that's also part of the process, something that we work through. So it's usually not anything major.
And for any music therapist that might be listening, or someone interested in the field, that might be a concern of theirs of how to approach it and introduce music therapy. Do you have any advice, or how do you kind of set the situation up in that instance?
Advice for
anyone who might be introducing music therapy for the first time, and someone might be resistant or not understand what to expect.
I guess just try to meet the client where they're at, try to understand, you know, why they might be nervous, or whatever the situation is, whatever the reason is for their, you know, maybe it's unconscious resistance, I don't know, but try to kind of meet them where they're at, figure out what they're feeling, and then just go from there.
That's great. So keeping the focus on them and their needs in that moment. That's excellent. Okay, so you talked about different interventions, songwriting or drumming. A lot of times in working with seniors or kids, we're doing a lot of live music in the moment. Are you doing more live music? Are you using recorded music as well? Is there a balance there?
I would say in my particular setting, I use a lot of maybe 40% live, 60% recorded.
Okay.
People do really connect with live music, but a lot of times recorded music, I think, in my particular setting, does a really, really good job of kind of reaching people because they hear, especially like if it's rap music or, certain beats, they want to hear their music. So they want to hear the particular nuances and the beats and the way that the person raps. And if I try to rap Eminem, I don't really sound like him. So sometimes, I think a lot of the time, I do end up using recorded music, but I'd also do live music too.
And you spoke a little bit to the benefits of both of those, but I know when I've kind of gone in to set up a program and meet with a program director, they have concerns about the music that we would use. The language in it, the themes in it, if it's music that's, since we as a culture associate music with our friends and our social situations, how do you address in that moment when a client is requesting to hear music that's very heavy on, being positive about drug themes or things that were their life before recovery? How would you address that?
Well, that's the $1 million question. I would say, first of all, I got to follow the facility's rules. So if I'm working somewhere and they specifically request, don't use explicit music, then I've got to follow that protocol. But I think in other situations, it's up to, I think it depends on what the goals are for the group. Sometimes I'll do kind of free associative song choice where the clients will get to pick whatever song they have on their heart or whatever song they want to hear. And then we'll kind of use that as rapport building or maybe like figuring out kind of where they are and go from there. But that is definitely a tough question because there are a lot of songs that are triggering. And if we are working through that, if we are using recorded music, for example, to maybe change their relationship to a song or explore that relationship to the song, then we might actually look at, what's being said in the song objectively or, how many cuss words are there because, that's something that is I think you can be objective about sometimes. But at the same time, recognizing that you can't always understand where people are coming from with their musical tastes. And I think music, because it's so personal to everybody, sometimes we got to step back and let go of our judgments about that person's musical taste to understand where they're coming from.
That's a really great point. We were talking to Raquel, who was on several months ago, art therapist, and Alexia, the dance and movement therapy intern. You've worked with both of them, and both of them talked a lot about using art and dance and movement as a metaphor in this setting and how powerful that is. How do you think that music serves as the metaphor in this, or do you think that?
Well, music is a type of language. I think it's a symbolic form of expression, and maybe unlike talk therapy or just straight up talking, music, art, dance, those are all other ways of expression and other modes of being. So I think music fits right into that, and it happens to be very relatable because most people do like music. I haven't met very many people who say that I hate music, and if they say that, maybe they mean, 5th grade trumpet lessons. But for the most part, everybody relates to music. So I think it's a very special and unique form of expression.
Absolutely, absolutely. When we come back from a brief commercial break, we'll be talking more in depth about why music is so effective in this situation. What are some specific examples of that? Also, stick around for some live music. We'll see you after the break.
Mom's fall was a wake-up call. We knew she needed help, But we also knew she'd never leave her home.
With jobs and kids, we can't always be there. We weren't sure who to trust to help around the house and make sure she takes her medications.
We did our research and found our answer. Bright Star Care. Their home care teams are led by registered nurses with help available 24/7.
Thanks to Bright Star Care, Mom can stay where she wants to be, at home.
For a standard of care that raises the bar, call 844 for Bright Star.
The Palm Beach Music Therapy Institute is a professional music therapy practice serving medical, community, and educational settings throughout Southeast Florida. With our experienced team of 11 board-certified music therapists, we use music and research-based therapeutic interventions to help individuals of all ages and abilities reach their goals and increase their quality of life. For more information on our services and programs, please visit our website at pbmti.com. Engage with us on Facebook, Twitter, or Instagram, or call us at 561-747-9944. You are listening to Palm Beach Music Therapy Connections. If you'd like to join the conversation, the toll-free number is 888-565-1470. Now back to the show. Thank you so much for joining us tonight. You're listening to and watching Palm Beach Music Therapy Connections. I'm your host, Bree Beynon. Here, my guest is one of our very own board-certified music therapists, Allie Saylor. She works in Palm Beach and Broward County, specifically working in recovery settings, addiction recovery settings. So we're talking about the role that music therapy plays in addiction recovery treatment. If you have any questions for Allie or myself, if you're listening in or watching, you can call us at 888-565-1470. Or as always, we are on Twitter and Facebook. If you have any questions or you're working in this setting and you have something you'd like to add to the conversation, you're a music therapist and maybe you want to add an intervention or a technique that you found to be really helpful, please. We'll always love to hear from our audience. So please either give us a call, a tweet, Facebook, reach out. We'd love to hear from you. So Allie, again, thank you so much for being here. We've been talking specifically about the music therapy, the role of music therapy in this setting, why it's so effective. In the beginning of the show, I was speaking about specific considerations when working with different ages or separating genders, male and female, and what to be aware of in all of those different settings. So what does that look like in your work? Are you working with groups that are specific to age and to gender, and what kind of difference does that make?
Yeah, I do a lot of different groups. I go to about maybe 15 different rehabs every week. So I see a lot of different people, a lot of different demographics. All of my groups look different. A lot of them are, well, they're split up different ways. Sometimes I'll do groups of all teenagers, sometimes groups of, males, groups of females. I would say the majority of my clients are probably males and females in their 20s and 30s, so they're still young adults. I also work with older adults that are 65 or maybe it's 55 and up, so they definitely have their own unique challenges too.
And what would it look like, the difference maybe between working with teenagers, working with adults, working with older adults? What are some of the specific themes that you see are concerns in each of those groups?
Well, teenagers are definitely in a very different place in life than maybe older adults. So they definitely have their own unique challenges. They're going through transitions. They're not really sure yet if they're still a kid or if they're an adult. So you have that whole dynamic on top of the addiction. And of course, as teenagers, they want to explore, they want to try things out. And a lot of times they not a lot of times, but some people turn to drugs, and that just brings a whole unique set of challenges to where they are in life.
Sure.
Older adults are also in their own unique stage of life. A lot of the adults that I see in rehab are there because of maybe loss. Maybe they've lost a spouse. They've lost physical abilities. Maybe they've had surgeries, or they've lost the ability to work. So they're kind of dealing with their own unique challenges around that whole period in their life that is accompanied by a lot of changes. And then a lot of them, maybe they weren't addicts before, maybe they weren't drinking heavily before, but they've started to now just because of the changes they've been going through.
Sure. You said that a majority of the groups that you're going to, clients you're seeing, are in that 20s and 30s?
I would say so.
Yeah, okay.
Yeah.
Any thoughts to why you think that might be? Is it that they're more apt to maybe go seek help at that age, or they're just any feedback, just kind of your own opinion?
That's a really tough question. I think that's something that I'm still trying to wrap my mind around. I think some of it is in part due to maybe where we are in our modern era. Maybe technology has had some sort of influence on, being like another form of anxiety, or another whole other dynamic that adds to pressures, maybe peer pressure. I don't really know, to be honest. Sure. It's not something that I've thought a lot about, but I think that might have something to do with it. I'm actually not really sure.
Yeah, sorry. I went off script there. Sorry.
That's okay.
But I think it's interesting to think about. Also, I wonder if more awareness is brought to the cause. I mean, if you follow politics at all, sometimes you can't help because it's literally everywhere right now. But mental health and substance abuse is something that's been on almost everyone's campaign trail. Regardless of the side of the aisle, people are realizing, because you can't ignore it anymore, what an issue it's becoming, especially in our area. Where we have a really high rate of it in the area that we live in. So I wonder if that will affect the trend as well, of who's seeking help, who's supporting their loved ones to seek help when they weren't before. I think in our grandparents' generation, it was very taboo. You didn't talk about it. So I wonder too if maybe those that you're seeing in your older adult group, they're just now coming to that situation because it wouldn't have been appropriate in their family structure to seek help years ago.
Possibly.
So we talked a little bit before the break about why music especially is so effective in this setting. If you could just kind of retouch on that, and you were saying that it's kind of a non-threatening approach at sometimes when maybe they've been doing the same kind of therapy and talking a lot. What makes music different, or maybe sometimes a bright spot for them?
Yeah, well, music, it is so personal, it is so individual. Most people, I think almost everybody likes music and can listen to music and relate to music. So it's definitely something that is very accessible, and I think has become such a big part of most people's lives. On top of that, I think music as an alternative way of expression, an alternative way of experiencing, as opposed to maybe just talking, offers a whole unique approach, a unique mode of exploring, reflecting, processing, whatever might be going on. So I think music, it just has a unique way of tapping into people's emotions, and especially in the recovery setting when a lot of people use drugs to mask or numb their emotions. Music is a great way to tap back into that, to allow people to once again feel, the feelings that they have been suppressing, and also to move through it in a healthy way.
It's an excellent point. We also talked about earlier how it's a very transient setting. People are coming and leaving a lot. Not everyone's on the same track. So oftentimes when you're walking into a group, several people are in different places of their recovery. And you mentioned briefly the 12 steps, and they're all in different steps and working through different things. How is music a way to kind of help group cohesion?
Well, I think music also has a unique way of bringing people together who, like you said, may be in different places, either in their recovery or their stage in life. And I just remember there was something that stuck out to me in college, something that a professor said. And I remember she said, the way we are in music is the way we are in life. And that stuck out to me because, especially in a music therapy group setting, it's just a unique way of being able to interact with people through music. I think music brings people together to be able to relate to each other in ways that maybe they didn't realize that they could connect with somebody else in that level. So it helps people relate to each other through the music itself. It's a way of relating to the music. It's a way of relating to other people through the music. So there's just so many different dynamics and ways of using music to draw connections between people that maybe you didn't see before if you were just talking to them, but maybe you can all experience it and feel it through a song that everybody could relate to. So that's just one example.
Yeah, absolutely. And I love that quote, and it actually leads right into my next question perfectly, which is, it's wonderful to create these moments within the recovery experience, but how do you see the skills that you're working on and addressing in music therapy transitioning to the real world when they leave?
Well, coming back to that quote, I really like that quote, and I'm going to say it again.
Sure.
The way we are in music is the way we are in life. And I think that because of the way that people interact in a group setting, especially, and in a music therapy in particular, you can draw parallels because the music therapy group is like a microcosm of the way that people are outside of the group. So what you work on, the progress you make, the things that you do can be directly related to what you're doing outside of the group as well.
Absolutely. Do you ever hear that kind of feedback from a client that maybe being in group has reawoken an interest in music or something that they want to follow up on afterwards?
Yeah, I hear a lot of people say, before I was addicted or before I was using, I always used to play the guitar. I used to be really into, playing the piano, or I was in a band, but they stopped because they started using and the drugs kind of took over everything that they did. And a lot of times in music therapy, they'll be inspired, and it's really cool to see because then they'll ask to play my guitar, or they'll be really into it, or they'll be sharing poems or lyrics or raps that they wrote while they're in treatment. So it's cool to see that spark get rekindled.
For sure, and to receive validation from their fellow group members in a safe space. Can only imagine how that must make them feel. What are some challenges of working in this setting?
There are plenty. Oh my goodness. I think probably the couple of the biggest challenges for me would be, as with any helping profession, there is kind of I don't know if it's the risk or the danger of being burnt out, because a lot of the people that I see, they have a lot of issues. They've been through a lot of trauma. Some of them have experienced loss, and it can be burdensome, if you're not taking care of yourself properly, if you're not practicing self-care. So just a lot of the heavy issues that come up can be a lot to process, even for me. Added to that, the sheer number of people that I see every week, because I work in so many different rehabs. I probably encounter between 150 to 200 clients every single week, and then that's always changing because it's such a transient setting. So I'm always meeting new people, and it can be a lot. So that's probably one of my biggest challenges. I would say another challenge would be a lot of people in rehabs, they get stuck in the rehab cycle, and a lot of the people that I see, they're coming in and out, they get discharged and they're back. So there's kind of a vicious cycle of, seeing the same people and over again that I thought I was supposed to be helping, but they're back. So, how do I process that? So that's probably another challenge, just figuring out if what I'm doing is even effective sometimes.
And that speaks to the power of that, having that team approach too, of where the site you're working, which I know is difficult when you're working in so many different sites, being able to check in with the other disciplines, who are seeing the same individuals as you, and making sure we're working on the same goals. You and I have had conversations outside of this about self-care and benefits of supervision, things like that. And you shared that you thought through this you've learned to adapt some good self-care. And for anyone who's listening and might be either a music therapist or another professional working in this setting, what advice would you give someone in regards to self-care?
I mean, seeing a therapist, for yourself or a counselor or somebody that can help you process kind of what you're dealing with is definitely really helpful. Like you said, supervision. Also doing your own work. I found that's been really, really helpful for me just to know that I'm doing what I need to do to be there for my clients. So that's definitely helpful. And just, having fun, I would say, just make sure you have time for fun activities that you like to do. I like to be really adventurous. So I'll go out and try new things. So that's something that's helped me personally.
And we're going to talk after this quick commercial break about one of your fun things to do, which is play in a band. I'm going to hear a little bit about your band and also hear some live music. So stick around after this break.
Mom's fall was a wake-up call. We knew she needed help, but we also knew she'd never leave her home.
With jobs and kids, we can't always be there. We weren't sure who to trust to help around the house and make sure she takes her medications.
We did our research and found our answer, Bright Star Care. Their home care teams are led by registered nurses, with help available 24/7.
Thanks to Bright Star Care, Mom can stay where she wants to be, at home.
For a standard of care that raises the bar, call 844 for Bright Star.
The Palm Beach Music Therapy Institute is a professional music therapy practice serving medical, community, and educational settings throughout Southeast Florida. With our experienced team of 11 board-certified music therapists, we use music and research-based therapeutic interventions to help individuals of all ages and abilities reach their goals and increase their quality of life. For more information on our services and programs, please visit our website at pbmti.com. Engage with us on Facebook, Twitter, or Instagram, or call us at 561-747-9944. You are listening to Palm Beach Music Therapy Connections. If you'd like to join the conversation, the toll-free number is 888-565-1470. Now back to the show. Good evening. Thank you so much for taking the time to listen and watch our program tonight. You are tuned into Palm Beach Music Therapy Connections. I'm your host, Bree Beynon. We're talking about the importance and the role of music therapy in addiction recovery. I'm here with one of our board-certified music therapists from the Palm Beach Music Therapy Institute, Allie Saylor. Again, thank you so much for being here, Allie. We've been talking a lot about her day-to-day role working in, like you said, just about 15 different recovery settings throughout Palm Beach and Broward County, working in different specialized groups, addressing the unique needs of working with teenagers, young adults, older adults, specifically working sometimes with just females, sometimes with just males, and also all together as a group as well. Talking about the different ways that music is able to reach these individuals and help them connect with themselves and also with others. So one thing I wanted to ask before we do get into some live music sharing, which is always very fun, is it's a heavy population to work with, and you've talked a lot about things that you've had to kind of learn along the way. To adapt to the needs of your clients and the unique set of challenges that come with that as well. What are some things you've learned about yourself personally and professionally working in this population?
It's hard to list everything I've learned off the top of my head. But I would say probably the biggest thing that sticks out to me the most, as something that I've learned, is I've seen how life can be really sad and painful sometimes. Just, hearing everything that my clients have gone through, and, it can be really heavy sometimes, but I think working in the setting has taught me that, I guess I'm no different than anybody else. And, I have my own struggles personally, and I may not have chosen to take it out or to cope with it through drugs, but I think there's not really much that separates me from other people.
Just having that sensitivity towards those that you work with, that's pretty powerful.
Absolutely.
So you in your most natural setting. For those who aren't watching the video feed, you have a guitar on now, which is how we usually look in our sessions, right? If we're doing live music that day, we've always kind of got a guitar not far away. So what song did you bring for us today, and how would you use that in a session, pardon me?
I'd like to share Wonderwall by Oasis. I chose that song because that does happen to be one of the most commonly requested songs. A lot of my clients happen to be people in their 20s and 30s, and so I think that's a song that a lot of them know. And I think that song can relate a lot to, maybe relationships, maybe codependency, drugs, love. There's a lot of different meanings you could get from it, so it just depends on how you want to present the song.
Wonderful. Okay.
Today is gonna be the day that they're gonna throw it back to you. By now, you should have somehow realized what you got to do. I don't believe that anybody feels the way I do about you now. Backbeat, the word is on the street that the fire in your eye is out. I'm sure you heard it all before, but you never really had a doubt. I don't believe that anybody feels the way I do about you now. And all the roads we have to walk are winding, and all the lights that light the way are blinding. There are many things that I would like to say to you, but I don't know how. 'Cause maybe you're gonna be the one that saves me. After all, you're my wonder wall. Today was gonna be the day, but they'll never throw it back to you. By now, you should have somehow realized what you're not to do. I don't believe that anybody feels the way I do about you now. And all the roads we have to walk are winding, and all the lights that light the way are blinding. There are many things that I would like to say to you, but I don't know how. 'Cause maybe you're gonna be the one that saves me. After all, you're my wonder wall.
Beautiful. Thank you so much. It's really kind of taken a second to actually listen to the words of that as you were singing it, and I can see how that would be really powerful in this setting, especially given the situations that you've talked about today. So thank you again for coming on and sharing all of this. We have just about 3 minutes left, and I want to give you an opportunity to talk about your fun, your self-care, what you're doing nights and weekends that I got a chance to see you a couple weeks ago at Downtown at the Garden. So tell us about your band.
Well, I'm in a band called Twisted Tapestry, and we are a group of eclectic musicians showcasing piano, harp, drums, and vocals. We play a lot of music from the 60s to today, as well as some of our own originals.
Very cool. What kind of venues do you play in?
We've played a couple of different places so far, Downtown at the Gardens, Brewhouse Gallery, Dada and Delray, so a couple of smaller venues, but we have some big plans coming up for other venues as well.
Wonderful. Well, I know I was thrilled to have an opportunity to check you out. You sounded amazing. If anyone wants to check out your band or get in touch with the band or yourself, how can they reach you?
Well, my band has a Facebook. We are facebook.com/Twisted Tapestry. So feel free to go on there, check us out, give us a like. And if anybody has any questions for me, my email is allie@pbmti.com.
Very cool. And Allie, A-L-I.
Correct.
At pbmti.com. Allie, thank you so much for taking the time to come out, talk about this really important topic and share your insight and your beautiful music. It was such a pleasure. Thanks, everyone, for tuning in. We'll see you next week. Have a wonderful week. Listening to Palm Beach Music Therapy Connections. We hope you enjoyed today's program and discovered new ways to bring music, art, and dance into your home or workplace. Please find a copy of today's show at pbmti.com. If you have any questions for our guest or myself, please email me at Bree, that's B-R-E-E, at pbmti.com, or call the Palm Beach Music Therapy Institute at 561-747-9944. Tune back in next week for an all-new live show. See you then.